Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the nation's leader in regenerative medicine therapies. Today the topic is the top 7 things to think about when considering a stem cell therapy. The first is that the regenerative procedures at our centers do not burn a bridge. What I mean is that if you were to undergo a surgical endgame procedure, such as a knee replacement or a fusion of the spine, so on and so forth, that bridge is then burned. The ends of the joint have been cut off and replaced with metal and plastic, or levels of the spine will have been fused together, and none of that is reversible. I do get asked that all the time. Is there any way to undo that joint replacement? I'm really not happy with it. No. So that's the first thing to consider, is that a stem cell therapy doesn't burn a bridge. The second thing to consider is, what is the safety profile of a regenerative cell therapy? Now, at our centers, we've never had a significant adverse event in close to 11,000 procedures. What does that mean? What that means is we've never had a deep infection, we've never had a disease transmission or rejection by somebody's body or an allergic reaction. None of those. It's been a very safe procedure. The lab where our biologics come from has been in existence for 14 years. They've done over 70,000 biologics, and they've never had a significant adverse event either. So the same cannot be said for all the labs and centers in the U.S., and it is something to consider. In addition, when you look at something like a bone marrow or an adipose procedure, those procedures may give you a very successful outcome, but they do have some potential side effects. Studies show that a bone marrow aspiration from your pelvis leads to about a 50% incidence of chronic pain from the aspiration site. All right, and that means that it's going to last over about 6 months. So that's a problem. The third thing to think about is, what are the outcomes with the stem cell therapy these days? Am I looking at 10%, 20%? Now when you look at our centers, our success rate overall is between 85 and 90% success. And that usually lasts for years. And what that means is that close to 9 out of 10 people who we ask, would you have the procedure done again? The answer is yes. A fourth thing to think about is, what's my downtime going to be with the regenerative cell therapy versus something else? And the answer is minimal, if any, at our centers. And obviously that's very different than a surgical procedure where the rehab and recovery might be 3, 6, 9, 12, 18 months, depending on how serious of a procedure you undergo, or if you have some side effect complications. Also, if you were to have a bone marrow or an adipose procedure, there is going to be some downtime while you recover from giving yourself the donation. Whether it's somebody aspirating your bone marrow or taking some of the fat tissue from you, there is going to be some healing time from that. It is something to consider when you think that you have virtually no downtime with the perinatal donor tissue. A fifth thing to think about when considering a stem cell therapy is, what could this procedure possibly do for me? What I mean by that is, what are you trying to avoid or get back to doing? Are you trying to avoid dialysis? Are you trying to avoid an amputation? Or are you trying to get back to playing golf more and not hurting for 3 days afterwards? Are you trying to get more energy? Are you trying to walk farther, breathe easier? Those are the things that we see success stories on all the time. So if that's something that you're looking forward to get back to doing, or avoiding a potential big problem like dialysis, it is possible. We don't guarantee it. It's not 100% satisfaction or 100% successful, but there's a very high percentage of people who have successful outcomes and do achieve their goals. Now, a sixth thing to think about is, what's the experience of the center that I'm considering having this done at? And what I mean by that is that our centers have done close to 11,000 successful procedures. We do a lot of training for providers. We have IRB protocols. We've never had a significant adverse event, and we have over 15 different protocols available for patients. So what that means is that we know what we're doing, our centers are very good at it, and we get great outcomes, and it's been very, very safe. So that's something to heavily consider, is, who am I looking at having this procedure done by? Now, the seventh thing to consider is, what is the investment going to be? People ask us every day, many, many times, what does it cost? What does it cost? And I agree that it's a really important consideration. But I look at it from the other side as, what is the investment in myself going to be? Because that's what it is. We invest all the time in new cars or additions to our homes or things like that, and we don't think that much about it. We only get one body in our lifetime. Why not invest in our health? That's exactly what's happening. So my recommendation is to think about it that way, and the investment at our centers ranges, anywhere from $3,500 up to about $8,000, and a lot of it depends on what's the condition. How bad is that condition? What's your individual physiology? Do you take 20 medications? Do you take 5? Do you smoke, drink? What's the lifestyle and risk factors and things like that? Because it may mean that you might need more biologic than someone who's in a different boat than you. So those are the top 7 things to think about when considering stem cell therapy. Visit us online today at r3stemcell.com. There's a lot of educational info on our website. And then click on our YouTube link, where there's also a lot of educational information and success stories where you can see real patients who had real procedures talk about their outcomes. Call us at 844-GET-STEM. We'll be happy to get you into a center close to you for a free consultation to see if you are a candidate for stem cell therapy. Thank you.